topic of my presentation, okay, is the factors influencing the utilization of prevention of mother-to-child transmission of HIV services in Makurdi, that's in Nigeria. Yeah. So the outlines, the HIV pandemic remains a major public health problem. And globally, when you look at it, about 52% of 37.9 million people living with HIV, they are women. And the objectives of this, our research, is to examine the factors that actually influence the utilization of prevention of mother-to-child transmission of HIV services. Yeah, the methodology that we adopted, okay, the HIV pandemic remains a major public health problem. And if you look at it globally, about 52% of 37.5 million people living with HIV are women. So the methodology we adopted, okay, the objective was to examine factors influencing the utilization of prevention of mother-to-child transmission of HIV services in Makurdi, Benue State in Nigeria. Yeah, the methodology we adopted for this research, it was a cross-sectional study, and about 337 HIV positive pregnant women was carefully selected across 6 hospitals and clinics in the state. Then the data collected were analyzed using SPSS version 22. Using version 22, multiple progression analysis were used at the P of 0.05 level of significance. Ethical clearance was actually obtained before this research was carried out. Yeah, when you look at our results, the demographic characteristics of the respondents, you see that majority are in the age group of greater than 30 years old. And we have 176, about 52.2% of all the participants were older than 30 years old. And you look at the marital status, about 87.6% of our respondents were married. 296 of them were married. While those that were widowed were just 0.6% were widowed. That's the result on the table 1. Then when you look at the level of education, you find out that those that attended tertiary institutions were about 163, that's 48.4% of our respondents actually had a tertiary education, while just 3, about 0.9% of our respondents, had no formal education. Then when you now look at the years they have been with HIV, those that were, their HIV duration was between 0 to 2 years, about 33.3% of the respondents, while majority of our respondents have had HIV with them for between 3 to 5 years. And those that were more than 5 years duration are just about 29.9%. Now, if you look at the multiple regression analysis of this, when we compare the demographic factors on the PMTCT utilization, we find out that age, you look that is statistically significant. 0.00 when you look at P, 0.000. Then basically also the educational status. Educational status also have significant impact on the PMTCT utilization. Then you look at the years of HIV. Also, the knowledge of the PMCT have an impact on the PMTCT utilization in the state. So even if you look at the income also has some impact. You see that the P is 0.021. Then you find out that most of these, the demographic factors, in conclusion of this study, find out that demographic factors actually influence utilization of PMTCT surfaces. And also the knowledge of PMTCT actually influence utilization of PMTCT surfaces. So you look at demographic characteristics have great impact. So part of our recommendations should be, one, there should be health talks to people on PMTCT surfaces, and also to be able to empower women. Empowerment of women so that they improve on their knowledge and utilization is very, very important. When they are empowered, they can actually take right decision at the right time, and it will help and improve on the utilization of prevention of mother-to-child transmission of HIV in the state.